but sometimes it's important to just have a little glimpse of the past, sort of just to frame the discussion. And there have been various times in the past. Unfortunately, Sri Mishra was not able to join us this morning, but he actually had an academic appointment here way back 20 years ago. Little tiny academic appointment in integrative medicine. And the person who we have joined here, where's Andrew? We have Andrew Shuboff, and as a part of our history, Andrew Shuboff was the president of the Student Integrative Medicine Club, where we had a little momentum back in 2008. Yes, or 2007, 2008, a long time ago. And we had the opportunity to invite Dr. Andrew Weil to campus, and since he was the president of the student club, it was his job to be the host, and he was a great host. And he went on to great things, which I learned about by, I have to tell you, I was just sort of glancing at LinkedIn's suggestions of people that I might want to connect with. Now that really tells you what a time waster I can be. And there was Andrew Shuboff, and I said, oh my goodness. And now I have a lot of students who are out there, but the reason I just couldn't help but notice is that he is now a faculty fellow at UCLA's East-West Center for Chinese Medicine. I've got that right. And so that's really quite an impressive life story. And I don't know much about what happened between 2008 or whatever it was and when we connected on LinkedIn. I said, you've got to come, he's here.
Residency.
Yes, right. I knew that part. At any rate, so he's here, and I've asked him to give us a little bit of information during the discussion session, which we'll have a lot of in a bit, to talk about what he's learned about the business models. So my talk is a few more minutes, and it's just about the business models. I think more of you are familiar with the current history, where Mark and an energetic team of people have put together the current program. But there's a little history here, and I am just briefly going to talk about it. Here we are. After Andrew left, we had another spurt of interest, and I, as a chaplain, and some others went and visited several sites. And we visited UCSF, which could not have been more wonderful and welcoming. And they have a research and philanthropy model, and they seem to have plenty of money. They're on a Friday, they didn't have a single patient in the place. But they have been very successful doing things the way they do it. We tried to visit UCLA, Andrew, and they wisely said no, or they said no, so we couldn't. And finally, we asked Jim Burklow, who is the chaplain. He said, they really haven't let the chaplain come to visit. And they did let the chaplain come to visit. And this is all, by the way, this is all out-of-date information, but this is just history. And they have a fee-for-service model, and I think that's actually true, isn't it?
It's insurance-based.
Yeah, right. Okay, it's insurance-based. We also visited Scripps, and they were fabulous. Mimi Guarneri hosted us, showed us around, talked to us, explained how she does things. She also has plenty of money, and she has built her program primarily by, she's a cardiologist, bringing patients in for their high-margin procedures, and then for the low-margin health maintenance and lifestyle and integrated programs, the high-margin subsidizes the low-margin. And I don't know if that's still true today, but that was definitely how she built the program. It's a very interesting model, and something that I tried very slightly to interest some of the high-margin people here on this campus in, but my time, as you saw. We also went to visit one of the many sports medicine programs that are on the west side of town, and which is really a sports medicine. This clinic treats a lot of USC student athletes, and it's obviously an insurance-based clinic as well. We also talked with, it was a virtual visit, but they were very nice to us, the University of Michigan, which has a family practice model, and they were the one place that seemed totally struggling, and they had every administrator hassle, they had trouble making any money, the family practice was having trouble making any money anyhow. We said, thank you very much. So, in a word, that is history. There are people too numerous to mention who've done very interesting things as part of history. but I just wanted to focus on the business models, explain that, and I was just talking to Lorraine, obviously timing is everything, getting all of these together is certainly a challenge, and leave it to you people to get us back on track and in the right direction. I will just mention over the side that Mark pointed out that we need to have access to patients and research facilities and so on and so forth. Of course, money is very important. So, with that, shall I introduce Lorraine? All right, you just introduced her very briefly. She comes to us from University of San Diego, and she just said to me as an aside that they had also spent a good deal of time working through different issues. So,
well, thank you so much for having me here, everyone. I just really appreciate the invitation from Mark. I had such a nice time at the Consortium of Academic Health Centers for Integrative Medicine conference, where I met Muna as well for the first time. And it's really fortunate to be part of this national organization. How many have heard of the Consortium of Academic Health Centers for Integrative Medicine? Don't ask me to pronounce the, how do you say the acronym? HIM, CAPM? Well, no one likes at the consortium to call it that anymore. It's all the consortium because no one can pronounce it. It sounds like you're clearing your throat or something. But anyway, so we all met there, and I think we're really fortunate to have this national organization that connects all of our integrative medicine centers across the country. And there's so much to be learned, as Sarah was saying, from looking at other models. Because this is a new field. And I think our goal, what I'm seeing as sort of the 30,000-foot goal, is we want to transform medicine. We want to make it a better place. And there's so many incredible things that sort of medicine has come to today, but to actually change healthcare and to make this, to transform this system, it's going to have to occur on many levels, and it's going to have to take place all across our country in many different areas. So this is a very collaborative field. That's part of the reason I'm here. Is that one of the benefits that I've always seen in this field is this willingness to share, willingness to see and be happy for each other's success and growth, because it means something bigger than any of us individually. I'm the managing director of the Center for Integrative Medicine at University of California, San Diego. I'm also the co-chair of the Business of Integrative Medicine subcommittee of the Consortium of Academic Health Centers for Integrative Medicine. And how I got that title is I kept on talking about business models and how it would be great to share more about this. And then, of course, when you want someone to do something for free, you just elect them to be head of that committee. So that's how that happened. And of course, I couldn't do it alone, so I asked Susan Carter from Vanderbilt, who was the only other kind of business person at the consortium at the time, to join me. So the two of us have led this committee. And I'm going to talk a little bit more about that, but just wanted to give you the background of those two hats that I'm coming from in this presentation. So before I get started, So I just wanted to give you a little bit of an overview about the University of California, San Diego's Center for Integrative Medicine program. And then I'm going to focus mostly on what I've learned from kind of all the other centers, and then I'll kind of conclude with where we're going with the Center for Integrative Medicine at UCSD. First of all, kind of depending who you're talking to, we just started at various times, almost as Sarah had mentioned. You could say you started probably way back in 2007, or you could say you started this year. It sort of depends on how you're looking at it. So for us, this was actually, the idea of integrative medicine went back almost 20 years with Ellen Beck and the Student Recovery Clinic Project, who's been incorporating acupuncture and all sorts of neat things into the community clinics. And then in 2009, we actually got an approval for our business plan. And then it wasn't until the end of 2010 that actually I came on board and we started to apply to be a member of the consortium and start to set things up, and actually finally moved to San Diego in 2011. And we first had our clinical opening by the end of 2011. So it really is quite a process. And people ask, when were you founded? And sometimes you have to just kind of pick a date. So 2010 is where I landed with that because it seems the closest. We also started with a micro grant. That's really how we ultimately got started. It was only $180,000 to start, but we over time were able to get more funds. Our total startup fund ended up being around $500,000 to get us to where we are today. And that is, we were really fortunate because we started off with an incredible team of integrative medicine physicians who were already passionate about trying to practice this way. They had seen that you cannot do the type of transformative kind of behavior change that you want to see in your patients in a 15-minute office visit. So these are hour-long office visits that are billed through the normal insurance models, billing per time. We also have osteopaths who are doing manual therapies, and as well as the integrative medicine consultations, wearing both of those hats. We have clinical psychologists, and I'm going to talk a little bit more about the importance of integrative mental health. I think it's a huge opportunity. And we have a center for mindfulness that really focuses on that. And then we have 6 acupuncturists who are kind of in our almost outposts. We've used them very strategically to help really live up to this sort of model that we wanted to have, which is kind of to be a part of every department and division of UCSD. This was actually in my first meeting with the Dean of Clinical Affairs, who was part of who's responsible for really giving us our initial funding. And he said, it's going to be administratively housed in family and preventive medicine, but I do not want this to just be a program off in the corner of family and preventive medicine. I literally want this to be a part of every single department and division of this university. So that's a huge mission. And it takes a lot to be able to actually live up to that horizontal model of being distributed across all of those departments and divisions. So we basically decided that acupuncture was going to be the almost spearhead, the way that we would be able to get into other departments and divisions, because although the field of integrative medicine is very holistic, and that's really more of a cultural change that needs to happen, acupuncture as a modality is very easy in a way. I mean, it has its own challenges that we've worked through and succeeded at so far, but it is much easier to get acupuncture, for example, as a modality into a department or division and then change the culture from within versus trying to impose a new whole-person culture all at once. So that's been part of our strategy. And the other thing, I always liked this kind of idea, it kind of makes me giggle, of integrative medicine is sometimes nicknamed resort medicine. Has anyone heard this before? Because it's both sort of spa-like and also sometimes considered the last resort where everyone will send people who they can't deal with. So we really wanted to change that philosophy, not just to be, okay, go off to this integrative person, or actually back in the day it was more complementary or alternative out there outside of the health system as the last resort. And we also didn't want to be out there, we kind of made lemonade out of lemons because we didn't have a huge budget to build a beautiful building, which would have been, in our minds, conceptually a great idea. Instead, we were sort of forced, and in a good way, to live up more to our mission, to be more distributed across the system. So that is the danger of having kind of a separate standalone center, is this idea of kind of being separated from the rest of the system, and then all the referrals go out there, and then they're kind of disconnected from the rest of the system. So every model has its pros and cons. I was very pro-horizontal model when we first started, and I've seen now both the exciting opportunities, high visibility, high impact that it can have, but now I'm also seeing the limitations, which you also do there. You can't always fit everything you want to do into the existing system. So I think it's a good place to start with the horizontal, to realize what are the gaps, what do you really need to build, what can you use that you already have, and then create something new and separate. And that's kind of the place, I think, where we are right now, and I'll get to that in a second. So I think it's important to learn from others. That was, again, something that Sarah pointed out that is just key. So that was when I first started, what I was so excited about being a member of the consortium. So I felt grateful that so many members were willing to talk to me and really, not just superficially, but give me so much valuable information just meeting one-on-one with these leaders from all across the country. So that started in 2010. They have about 2 meetings a year. So I've been kind of consistently trying to talk with everyone. I think I've gotten a chance to talk to most of the leaders across the 60 members. And so I've also had a chance to talk with a lot of sort of stakeholders in executive team, which is composed of about 8, it was that team that I had mentioned before, the 8 physicians, psychologists, head of acupuncture, kind of represents all of our acupuncturists. And then our advisory board, which is a bunch of wonderful people in the community, leaders in the community, business owners, philanthropists, etc. So when I was first asking some of these questions about business models, the consortium said, oh, actually, we did 2 studies. You should look at our 2 surveys. You should read these surveys. So I thought, oh, that sounds great. So I looked at these 2 surveys, which were done in 2007 and 2008, and I kind of pulled through all the information. And one of the limitations sometimes of surveys is that they're designed to ask great questions, but then when you're trying to use the questions, it's sort of like, how do I make sense of it? It just seems like data. It's not really, making sense of it. So I really felt like there were some key questions that we needed to know. So I looked at some other reports and models. Penny George Institute at Abbott Northwestern Hospital. How many people know about this? This is just a fabulous, fabulous organization. They are inpatient. So if you're going into the inpatient realm, they have sort of the best research done on integrative medicine in the inpatient setting. They've showed that pain and anxiety scores went, so I guess I should just back up. So the Penny George Institute funded Abbott Northwestern Hospital for their initial pilot integrative medicine inpatient program. That turned out over the first couple of years to be so successful, and they were able to, because they did such a good job measuring health outcomes as a result of these integrative services that were delivered by nurses and by acupuncturists and massage therapists. That was the team that were in each unit. And then the nurses were trained in about 20 different modalities that they could do. Now, they weren't experts in all of them, but they had that sort of limited, I can do a little hand and foot, acute care type of massage. I can do a little bit of aromatherapies. They had very specific aromas that they would use for that context. So again, they were not the experts, but they were the ones that knew what they could do in that very kind of limited setting. That was so successful that Abbott Northwestern Hospital, now for the past 10 or more years, has been totally funding their programs. So that's the just value of research, as Mark was saying. So everything that we're doing at the Center for Integrative Medicine, we started off we're collecting all the data for our electronic medical record, EPIC. I'm focusing a lot, I should say too, in this whole presentation on the clinical aspect of things. We have, I think, the same mission that USC has, which it covers both clinical, research, and education, all of those mission areas. And I can talk a little bit more about that maybe in the discussion, but this presentation I really tried to focus on the clinical, but it is hard to separate them out because they are so interconnected, especially with the practice-based research and the fact that as you record everything that you're doing in a clinical standpoint, then it is just incredible for research and for sort of justifying your existence. So the other study that was done in 2012 is the Bravewell report. This was an excellent report as well, but it also wasn't answering some of those sort of pressing questions that I had from a business standpoint of how to do a Center for Integrative Medicine in a way that would be financially sustainable. And then, so what we did was in 2012, we put together a survey through this business committee, and we, first an initial survey just to kind of figure out who wants to be on a committee, what kind of things they're interested in, and I'll show you in a second a couple of those results. And then we did a bunch of conference calls to kind of get closer to what we wanted to find out, and then we ultimately did a more comprehensive survey released at the end of 2012, which we reported on at the conference, and then we updated that survey. Researchers look at it, give us some advice. Actually, our questions were surprisingly well designed. I was very surprised about that. That was exciting. And then, so we didn't make too many changes, but a few very specific changes, and we did a 2013 study as well. So I'm going to report on some of those results. The first thing that we did in our very preliminary, very small survey, the one just to kind of find out, it was a survey monkey, what people were interested in. This was one of the questions I thought was very interesting. Is your center in the black yet? In other words, this is exactly kind of how we worded it. We changed it a little bit later, but is it financially sustainable without outside support from your parent, academic health center, or donors? We really wanted to know if it was operating on its own sort of clinical income. And so, yeah, most people were not. most profitable that we found through all of those pieces of data. So this is just kind of everything summarized in one piece. If you want to know kind of what comes from what, I'm happy to break that down later. But I just thought, let's synthesize it. What are the kind of gold nuggets? So that's what this is. Clinical services, what was most profitable, surprisingly, chiropractic. We don't even have chiropractors actually at UCSD Center for Integrative Medicine. We do have osteopaths who are providing manual therapies, and indeed, they are doing very well. It actually wasn't until we incorporated the manual therapy into our bottom line that we really started to do well. So that was one really interesting key. Acupuncture also does really well. Some centers do really well with acupuncture, some are losing money with acupuncture. So that is variable on many different realms, how it's set up, whether insurance, not all insurance policies accept acupuncture yet, but hopefully that will change. Integrated mental health is another huge field. That's actually Vanderbilt's strength and what is really helping them be so financially self-sustaining is their focus on integrated mental health. Business models, we saw that some have the horizontal model distributed across their sector or across their departments and divisions. Others have a vertical model, and that's just a standalone building. And then what we're noticing more and more is these hybrids are coming up, where there'll be a specific building that is dedicated, but then there's also these outshoots that go into other parts of the system, of the health system. And I'm starting to lean toward not one versus the other, but really the fact that a hybrid model probably is the ideal model. Kind of like everything in life, you want it to be more clear-cut, black or white, but it's more gray. So the drivers, champions. I cannot emphasize this enough. This is really how I think we have been successful so far, is that we had a team right off the get-go of dedicated physicians who are excited, we want to make this happen. Now, this is their 5th job, so as they don't have the time to always do it, so it really wasn't until we had the resources to get a team together and to actually hire people to make this happen that it actually started to happen. But they were there, and the path had been paved for so many years of people wanting this to happen that when we finally got a little bit of resources behind it, it was just able to shoot forward so much more quickly. And we started to interview and put together surveys of from all the departments and divisions, who's interested. And we do sort of service meetings going around the departments and divisions. Here's how you refer, anyone interested. And actually the response has been incredibly overwhelming. I was expecting more maybe hesitation, more people being resistant, but in fact from sort of the top down, it's been incredibly, everyone's been very receptive. So I think having those champions who can stand up and say, I'm behind this, I really want to make this happen, that's where I think to kind of build. Then strong philanthropy. I'm going to talk about this later, so I'm going to skip over this one for now, but it is a very important piece to this whole puzzle. Group classes, this is another way that we can reach people, a wide variety of people, using our resources wisely. So instead of meeting, one-on-one visits are incredibly important, but as many of you probably realize, a primary care physician, primary care department, typically is the loss leader for a health system. So our integrated medicine physicians are, in fact, really kind of even losing a little bit more money, I want to say. It sounds so terrible, but really because they're having a longer office visit, there's not that insurance incentive that actually reimburses at the same level. So physicians are reimbursed on an RVU system, and basically those are like the gold nuggets of their time that gets translated into dollars. So if they see 15-minute patients all day, and you add up the number of RVUs, it's actually a larger number than if you see hour-long patients. So there's a little bit of a disincentive. So what we were able to do, thanks to our chief of family preventive medicine, he was actually able to negotiate that this cost savings that those physicians were providing for the system, and the cost savings was because they're only using one exam room instead of 2, and they're not using the same level of support staff. That all translated into a cost savings that he was able to negotiate to return back to the physicians to give them the same level of incentive. So I thought that was pretty cool, and we can give you more information on that if you want. But yes, but back to group classes, that once again gives us a little bit more, bang for our buck, so to speak. So and I guess I should say too, our Center for Mindfulness has been going on for such a long time. We also have a natural healing and cooking program. We've just got Tai Chi. We're sort of the hub in California for this Tai Chi Movement for Better Balance with the California Department of Public Health that we teach, train, and help kind of do continuing education for. So we had that strength because one of our acupuncturists actually is a Tai Chi master. So it's basically, again, looking at who your champions are, who are your experts, and then kind of building from that. That's really been what we've done. And then external partnerships could not be more important. I think if we're trying to really change medicine, change healthcare, we have to do it as a team. And the more diverse that team is, the better. That's just very basic common sense, actually, and also well-researched. Outreach and innovation. I mean, this is all pretty self-explanatory. Internally, communication, collaboration, case conferences, the fact that someone can come to your center and get the collective wisdom of many different people and modalities is a huge selling point. I mean, that's what I would want. I would want multiple opinions. So that's really what these case conferences are, to have that opportunity to share tough patient cases with a wide variety of practitioners. And then metrics are so critical. So like we were talking about for the Penny George Institute in Northwestern Hospital, if they had not been actively recording all of their patient outcomes, they would not be funded by their hospital. So the fact that we have the opportunity, most of us with electronic medical records today, is that we have the ability to record all of our activity, our revenue, I mean, all of these different metrics. And this really helps with our decision making every year on how we need to either change things or be optimizing things from an operational standpoint. And then also from kind of a marketing standpoint when we're trying to justify getting more funds or doing philanthropy. And then ultimately, it shows our impact. And these are some of the other things that are obviously really important to an academic health center: patient satisfaction, return on investment, length of stay if it's in the hospital, things like that. So these were some survey results I wanted to pull together from the various pieces. One is that in 2007, the survey, actually this was kind of the one really, I felt, important piece from all of that data was, what does it really take to start up an integrative medicine center? Well, most people think, like our micro grant was $180,000 and we were expected to get started up in about a year. I mean, that's realistic, right? Well, apparently not, and as we learned, it's definitely not. So what it said in 2007 was that in 2 years, people were able to about average get started up, and it took around $708,000. We asked this question again in 2012, but we didn't really word how many years it started up. It was kind of worded strangely, so we didn't really get that data as much. So that was one thing we fixed in 2013. But we found that the 2012 was around 937,000 average startup, and in 2013, the average was about, and we had a larger response rate. It was 4.4 years and $1.3 million. And this is quite a wide range. This is not to say you have to have 1.3 million. Some people, the range actually was from like 300,000 to several million. And it really depends on, are you building a physical structure, how you set up. So don't let that be daunting, but at the same time, be realistic about it, that it is going to take, I'm sure all of us are realistic, but when we're pitching it to the people that need to fund it, I think there needs to be a certain level of more realistic expectations. And philanthropy was at the core. This was very interesting to me because I wish that I had actually known this when I first started. I suspected it, but it was just really me starting as the only administrator who really didn't have any development support for UCSD at all. And it was sort of difficult to kind of figure out how to prioritize one person's time. I do wish that we had started from the beginning with a philanthropic focus, because I think maybe we could have leveraged our initial micro grant and gotten matching funds from philanthropists. That would have been fabulous. And so I think having a really strong sort of development and philanthropic focus at the very beginning startup expense as soon as possible would be a great way to start if I could do it over again. Of course, you always kind of make things work with what you have, but I thought this was fascinating that of this kind of financial breakdown of how much philanthropy really does drive these integrated medicine efforts. So the other thing, this kind of speaks to the same thing from the other one that I showed you was the 2012 results, and this is 2013. This was sort of startup funding from different sources. So if you kind of see the breakdown, kind of what came where. And then what percentage of revenue came from the most recent fiscal year? I thought this was interesting. So indeed, clinical revenue really is driving the kind of long-term sustainability. So not to forget that. I think philanthropy is absolutely key, especially for those that are kind of nonprofits. That sort of makes sense maybe to continue that as part of your plan and always whenever you can. But that clinical revenue ultimately will be a large percentage of revenue. So what's next nationally? We are trying to started our conference calls again for the Business of Integrative Medicine subcommittee, and I think Muna hopefully will be a part of that. So we have been talking about having her as a member because we really need more business people on the committee and people who have philanthropic and development backgrounds. So that would be just a huge benefit to us, and just really excited to kind of have this whole team on board. And then the fact that we have this opportunity to share business plans, financial models, everything from scripts and frequently asked questions, and we've all developed these things on our own, but to be able to share them, there's just so much more of an ability to leverage what's already been done. The other thing is that we discuss various topics, what are sort of innovative things that each centers are doing. So we're deciding kind of how this year's strategic plan is going to kind of how this committee is going to roll out its topics and all of that stuff. So last year we had done kind of what's kind of the 5-minute, what are the top gold nuggets that each center could submit and provide. So that was kind of a fun thing. And then we did a lot of focus on the survey. So this year we'll need to figure out how we want to really structure that. And then I think our goal is really to have that survey continue and become even more comprehensive and answering even more of our questions. And get a higher response rate, because always you want to try to get everybody to be 100%, because why not? There are only 60 centers, so that would be good. So what's next for us? We are now, I'm really excited about this. Our CEO, Paul Viviano, just had announced, and UCSD has been going through a strategic planning process for about a year, and they came up with their strategic plan at the end of last year, end of 2013. And in just wonderfully exciting moment, we discovered that patient experience is kind of at the top of the strategic plan, and that integrative medicine is going to be a key driver of this patient experience. So now our Center for Integrative Medicine has finally, at long last, gotten the attention of sort of our entire health system, and now we're getting support from development, which has really been helping with kind of all of our fundraising. We're getting support from marketing. We're getting all these different areas now that, because we're now officially a part of the UCSD strategic plan, we now have a place in everyone's mind of how we fit in and what we do. We were still kind of off on the side, even though we were trying to be integrated. It's taken a while. So that's very exciting. We have an advisory board, and our CEO has graciously accepted a position on our advisory board, and we are really focusing this next year on how we're going to make this happen. We're doing an inpatient pilot right now, using a similar model to the Penny George model that I mentioned before, where we have a nurse right now who's trained in a bunch of different modalities, and an acupuncturist who's trained in a bunch of modalities. The nurse also is trained in acupuncture, and the acupuncturist has even more modalities. So it's really a neat team, and they're going around and talking to patients right now, and our family medicine staff, on how they're doing and all sorts of questions, and then hopefully delivering on services, and then we're recording all of that. I can give more information on that as needed. We're really focusing again on our fundraising and development efforts. classes and certification programs, kind of growing those and translating them into potentially even nationally impactful programs. Continuing to look for and supporting integrative medicine champions across the department's divisions and then also within the community, which is so important. Southern California is just a hub for experts in this type of area. We are so lucky where we live. It's just incredible. So highly encourage just finding those champions, those experts in the field, and then really kind of using those as the strength in developing this center. And then we're going to experiment with some other kind of creative membership and sort of bundle type of services in our concierge practice and kind of with our employees. And then excitingly about our employees, on the policy side, UC Care, UC is now its own insurer, so we have talked to them about having acupuncture as a covered benefit in next year's release, which is what they've said they're going to do. So we'll hopefully have that followed through, so we're going to keep on them about that and make sure that we are leveraging this incredible power of UCSD as now an insurer to hopefully set a precedent for other healthcare insurers across the country. So that's the plan. This is, again, all clinical. There are so many things on the research and sort of education front. I guess I'll say, I said a little bit about research. One quick thing about education is we've completely redone the medical school curriculum. And there's clinical rotations in integrative medicine. There's an elective in integrative medicine. And now actually mindfulness practice is a requirement for first and second year students that for the practice of medicine, they're all doing meditation. So what an amazing world that would be if you're a physician, before they're going to do something like a surgery, or if they can do a little mindfulness practice, or any physician who's going into any situation that it's a highly stressful job, and to be able to have that practice that's an anchor and can bring that centeredness into their practice, boy, that's exciting. And we're also training the nurses in mindfulness, so nursing is just a huge, huge strength, really. So we need to be working with the nurses. And we are, and that's what we really see as being a great group to leverage. And I think that's pretty much it. Thank you all so much. This is my contact information. I'm sorry, I think I ran out of cards, but if you want to jot down my contact information, and then if you want to give me a card if there's anything that we can talk about more offline, I'll be willing and happy to help with any other questions or anything that I can do to support your success here at USC, because again, we're all partners in this mission to transform healthcare. Thank you very much.
We're going to finish up with Una Darian from the view of future policy making and business models that we might follow at USC now, and then we'll have questions for the whole panel.
Well, thank you, Lorraine. That was great. I mean, you guys really advanced things quite a way, and it just gives us something, to really hold on to. It all feels very intangible sometimes. I mean, you've done an amazing job, and that's what we're here to do. So most of you know that I have been helping sort of on the fundraising front with the Institute, but I'm also a doctoral student. I'm at this USC Saul Price School of Public Policy, and I'm getting a doctorate in public policy, DPPD, Doctor of Policy Planning and Development, and I'm planning to use this as my final project, and my director is very excited about it. A lot of people over there are very excited about it, so I'm hoping to be able to really leverage a lot of the resources of the university through that and really help push this whole institute along where we all want it to go. I think we're all seeing the same vision. If you don't know, I have an MBA. I love, creating businesses and being a part of, listening to the business model, all that. That is very exciting for me. And so I'm really happy to be a part of that and to be able to keep doing that. I've been looking at a lot of the same stuff Lorraine was talking about with the Bravewell Collaborative and their studies. I'm looking at the Affordable Care Act and what's happening with insurance. And at this point, although I'm talking about all this, I don't know where it's all going to end up, but I'm taking all the information. You can't hear me, is that what you're saying? So I'm sort of just taking in a lot of information, and this semester I'm starting my prospectus class, which is the literature review, and I'm sort of going to get a focus on, I thought this wasn't working. Is it working? That's not working. Well, so the Okay, so can you guys hear me now? I feel like I'm screaming, but okay. All right, so basically I'm just starting in this class, and I've got my director very excited about this, and she really wants to help me to move forward on this. So this semester I'm going to get an idea on the topic, I'm looking at the literature review, and I'm going to start moving things forward. I'm very happy that I was able to join Mark in Chicago for this consortium meeting where I got to meet Lorraine and just a slew of fabulous people, like-minded, who are all very open and available to helping us. So I want to be that key person who can reach out and allow the doctors and researchers to do the actual work. And I hope to be the person who can kind of be behind the scenes, connecting the dots, looking at, what business model makes sense for us, what the mix is going to be of philanthropic money, billings, and, grants from the government. So I'll hopefully be looking at all that kind of stuff, and also looking at some of the things that are very unique about USC. And one of the things that I really love about this place is that our strategic plan talks very much about the multidisciplinary research that we all do. And I think it's really special. Lorraine talked about how they're doing it at UCSD, but USC seems just created to be that sort of a place. We've got all these different schools, and we're beautifully set up with so much interest from so many different people. And so I would like to also be a part of bringing everyone together and moving this forward, so it is something that the entire university is on board with. I was so interested to learn all this stuff from you, that you're on that way, and we see it's all possible with UCSD in the lead, so that's wonderful. As I really kind of look out, and I just kind of use a little imagination, and I think about where we might take this, we're sort of very much in the preliminary stages. I think sometimes we've got all these wonderful satellite offices, and there's no reason why we can't start moving these services out into some of the other spaces, especially in Beverly Hills. That would probably be a really good place. So I'm hoping at some point to move forward. I'm just throwing out a lot of interesting thoughts that we've had, and I'd like to see maybe even at some point interrupting our master plan and getting a building that's dedicated to health and wellness, that we can bring people to be a part of the Institute of Integrative Health in a very tangible way, and thinking about what that looks like and what that feels like for our people to come here, not just to be treated, but to really do what Lorraine was talking about and change the way medicine is practiced, coming here for wellness, coming here for prevention, coming here for health. And that's something that we're all doing together, and I'm just really excited to be able to be a part of it and hopefully help guide some of this. And I'm very open to all of your suggestions, so anything you guys want to tell me, I'm very excited to be a part of it. So that's it.
Okay, so we're going to open this up. We hope all of these exciting ideas will generate some thoughts on your part, and we'll have a lively conversation. Any questions or comments or anything just to get it started? Just identify, if you can, who you're directing it to, even if it's all. Ms. Lynn first.
Okay, Lori, I'd like to compliment you. That was so exciting, and in a way, you're just so articulate, and you've got it all up there on the screen. What I've been doing for 15 years is having an art gallery at the Institute for Genetic Medicine, so the technology and lab technicians going through this space that the administrators and principal investigators work in, that brings that together, and then it links the School of Fine Arts, the School of Education, the Dornsife and School of Public Policy, and I have advisors from all those groups, and for 13 years we've been doing this, and nobody's actually quite gotten it. So I did also, as you did, think about top-down and bottom-up and horizontal. And I love what you did with getting your CIM to be a part of every department, and that's what we're trying to do. We actually already have active partnerships now going into LAUSD with Rosser School of Education, School of Social Work, et cetera, but the thing that I think is important, and the hardest part in a way, is to help the top is sending down. So what I see, it has to be top down and bottom up simultaneously so that they're growing toward each other. And I think everything that you're doing is doing that. But I just wanted to bring the bottom up in with your top down, so we address that too.
Yeah, we're just starting, actually, I'm so excited about it this year. We're turning our case conferences now, the meetings that I said where you bring a difficult patient case and then everyone talks about it. We're actually bringing those to the community now, and we're engaging the community, even them bringing their cases. So we have naturopaths and acupuncturists, and they're all getting credit for it too. It's a continuing education event, we're doing them monthly. So there's a case, and then we have a whole auditorium, we'll be recording them, and so that's one way to kind of engage this, you're right, this incredibly rich resource in our community and tying them to our health professionals within the system, at least one way that we're thinking of. And then some conferences, we try to do annual conferences, but you're absolutely right.
Are you doing webinars?
We have done a couple of webinars, but what we'll probably do is take the content that we record and then maybe attach webinars so people have a chance to do an interactive side of things. But yeah, webinars are great too. Probably use them as much as we can.
Cheryl?
So this is really a point for everybody in the room, because mindfulness came up so much, that the university has a plan to become a mindful university. And there's a number of people who are going to be trained beginning this semester by a master on the University Park campus, and it's going to be trained trainers, so we're going to hope to bring mindfulness to this campus. I'm going to be one of the people who's trained. I don't know if anybody else in the room is, but I found out about that through CET. So pay attention to CET mailings, because the Center for Excellence in Teaching. And just the world goes around. Paul Viviano used to be the administrator here at USC University Hospital. So maybe there's hope that we can get back to it.
What department are you in?
I'm in biophysiology and physical therapy. I have a question.
You said in your survey that you asked if people were self-sustaining, not including philanthropy. And one chapter of our history that I skipped over is that the reason we took it upon ourselves to visit so many places is there was a potential donor. The potential donor didn't donate, but it clued us into the enormous importance of philanthropy. And I would say that a place like UCSF, which is very successful with grant writing, getting grants, but also the Oshner, there's more than one Oshner centers, and the Oshner people just keep sending them money. And so, as far as as long as you can raise the money,
Right, exactly. Who cares where it comes from?
I mean, as long as it doesn't come in the dean's pocket.
Right.
My name is Mary Hardy, and I've been involved in integrative medicine development in this town for almost 20 years. And been on in the CACA, been on the clinical committee. So those surveys you were talking about, we did. So I think it's really important to answer that point, because in historical perspective, none of this started and none of this sustained at all without philanthropy. However, after 20 years without this big change in the community, and all the philanthropists thought, we'll give you money, you'll change medicine in 10 minutes, and we'll all be happy. The point I think that's the most critical thing you said, that the transition that we have to make is to somehow be self-sustaining, so that if we get philanthropy fatigue, or philanthropy that's too rigid, I want it this way, not that way, this is the key point. If we can develop streams of revenue and ways to be more self-sustaining, then I think this will be a system that can hang around long enough to change everything else. Otherwise, it's going to be the flash in the pan that there's a lot of pushback now on the research level, where the National Center for Complementary Alternative Medicine is routinely requested to be defunded. And because it's tight budget times and they want that money back. So philanthropy is great, but you've got to also find ways that you can demonstrate value, be self-sustaining, generate revenue, or we're not going to be long enough to make those changes.
Yes,
Yes.
So in talking about and addressing that, actually, the elephant in the room is the change to the healthcare system. I went to the UCLA Center for East-West Medicine. They are kind of exclusively insurance-based, and they come with a lot of difficulties similar to actually what I found in the realm of palliative care, which is generally they want to spend a lot of time, they know what the right intervention is, but insurance companies won't pay for that intervention. And instead, at least at my experience at Cedars, is that these palliative care departments, or generally cost savings departments that are doing the right thing and everybody loves them, are getting cut from top down in exchange for revenue generating departments, orthopedists, cardiologists. You do what you're paid to do. Whereas like integrative medicine, generally in a kind of large scale, the benefit is cost savings, not so much revenue generating from the traditional model. USC has a very interesting position in that, and I know at least up in Oakland, Alameda County Hospital, I heard they have an inpatient acupuncturist that was actually hired from the top down as a cost-saving measure for the whole hospital. And that's something that can happen in a large institution of limited funds, set funds where you can salary an employee and they're not actually tied to specific billing codes that they have to bring in. With the accountable care organizations, this might actually happen on a larger scale, but one of the big strengths of USC would be to tap into that resource if you can use that penny grant information.
That's the point, demonstrate value, and even the cost savings value extinguishes over time. So I think there has to be a way that this can be valued creatively, and I think that's the next challenge, is ways that, because we give our revenue away. You know, we started the program at Cedars, we gave our revenue away for the dietary supplements. They didn't optimize it, we didn't count it, and so we were unable to really get that to offset basically losses. You take a low margin, high intensity work, primary care, make it more intense, and the economics stack against you unless you can be more creative about it. So just a caution from someone who's been through this a lot.
Great comments.
Yes.
Yeah, in the back.
I've been using complementary healthcare practices for like 30 years for my own healthcare, but I spend several $1,000s a year out of pocket for that. And one of my concerns as a mental health nurse that's worked in the community for many years has been, one of my passions has always been, what about people who can't afford it? You know, the low income, the underserved, who can barely afford traditional medical care. What are the thoughts of you or other people around the country doing to try to get this to underserved populations?
I think that's an excellent question. I definitely have thoughts. Do you guys either comment on that?
You give us your thoughts first, and then I'll take a thought.
So, I feel really fortunate. I mentioned briefly about the Student Run Free Clinic project at UCSD. It's such a fabulous program, and Ellen Beck is on our executive team for the Center for Integrative Medicine as well. And basically, we have been able to work with her, so anything that we're doing on the kind of integrative medicine front in general is also getting to underserved. The other thing, speaking about philanthropy, is I found that, I was kind of focused on where can we get the leverage for the real revenue generating programs, just to start, just to get us going, so that we have enough to then be giving free services as well. That was kind of my mental thought. And so I'm looking for grants, but really, all the grants that I kept finding were for actually underserved programs in integrative medicine. So there is hope there. I think there's a lot of interest from philanthropists to do underserved integrative medicine programs. So if that's your passion, I bet you will be super successful in it, because I've seen a ton of money for it. On the other side, the funding for just general integrative medicine stuff, that's more difficult. And I don't know that we can, kind of what Mary's saying, I don't know that we can count on it. It's something, if we can make a model that actually generates revenue, it will be scalable. Other people will do it. It will change healthcare. And if we do that, we're going to be able to then give free services to those who need it as well.
Great points, but I do want to put in one additional plug for philanthropy, because here we are at USC, and we have a president. When you hear him speak, you just want to reach up on him.
You're lucky.
Right. And so we need to put it in perspective, but we also need to recall that if we do it right, it's actually a sustainable source of revenue.
Right.
So both, you're both
Right. And there is a model for successful delivery to the underserved population, which I was involved with at the Dennis Family Clinic. And there's a chronic pain program there. that's been now sustained with initial philanthropy and now is largely sustained with some continuing philanthropy, but by using student services from local chiropractic before they left town and acupuncturists. So there's lots of ways to slice this pie, actually.
So Lorraine, could you talk a little bit about the research and how that's integrated, no pun intended, into your center? Who's doing research there? How do you handle the indirects? Who gets the indirect costs? Who's funded?
So from our Center for Integrative Medicine research perspective, we started by having a research committee. And in that research committee are two co-chairs, Gordon Sachs and Paul Mills. Paul Mills is also director over at our CTR, Clinical Research, Translational Research Institute. And they're doing a lot of mind-body research. Other researchers on our team, so everyone who came together on that research team was already doing CAM-type research at UCSD and had their own sort of mechanisms and funding and all that stuff. So we were kind of more the navigator. We kind of connected everybody, said, okay, how can, and part of what we came together to do, there were several things. One, the first successful sort of initiative was they put together the patient questionnaire so that every patient that came through would be getting a standard set of questions that then we could use for practice-based research. And now we're applying to be part of BraveNet, which is the consortium of academic health centers with integrated medicine's sort of database of bringing together all of their practice-based research. So that's really an exciting sort of future thing.
Do you have a biostatistician or somebody that?
We do on the team have a biostatistician, and we have potential. Right now we have a really kind of neat opportunity. It's a charitable remainder trust that will turn into a research endowment, and we're getting kind of the first allocation funding while the donor's still alive in this coming year. So I'll be able to answer your question about the kind of logistics of how our research will work in the center once we actually get our hands around that. If you want to talk to any of the researchers on the team, I can give you their contact information and connect you because they've had that direct experience with costs and how you manage, you know, all the kind of things you need to manage with research projects. And then we're also partnering with Samueli Institute, which is a fabulous research for complementary alternative medicine hub in Washington, D.C. So they do a research methods course and a systematic review course that we're co-hosting at UCSD to help other researchers and clinicians who are interested in kind of practice-based research. How do you actually do a systematic review and kind of help bridge some of that knowledge gap that kind of helps people who might have a good idea or want to do something more in the complementary alternative medicine. So those are a little bit of the things we're doing.
Great, thank you.
Yeah.
Chris?
I'm just interested in what was the driving force? Did you hire integrative physicians and then patients were seeking the physicians, or was the physicians talking to the patients and just asking them, would you like integrated medicine, this is what I could offer, or was it obviously a combination of both? And then how did you market that, or did it just kind of develop as word of mouth?
Oh, it's such a good question. So I guess first we were really lucky that we already had at UCSD physicians who were passionate about integrative medicine. So it was sort of like already, in fact, there were two of the physicians who told our division chief, if you don't start integrative medicine, they were residents going to make a start there, and they said, well, if you don't start integrative medicine, we're out of here. And so basically that was kind of one of the impetus, pieces of impetus to get to the business plan together and pitch that, and then now they're part of the team, and so that all kind of unfolded in that way. And then, yes, we also do marketing. We have a website, a brochure, and we do a lot of outreach, and we've used events as kind of our best way to do high-impact marketing. We don't do a lot of like ads or anything like that because we just don't have the money for them. Not to say that they couldn't be valuable if used in the right way, but we felt that there are a lot of like free community events that you can be a part of, and so we found those are really high impact because people will love like a cooking demo anywhere. We talk about food and people love it there. So it's been easy, or a mindfulness piece, or something else that's been very easy to get into community events, and it's almost like no cost except time, which is a cost, and we should consider it as one. But basically, it's just getting out there and having something basic, a brochure, and always collecting names. So I always think of like our marketing efforts as the golden sort of rule of what you always want to do is you're trying to collect names no matter what. So you may go and give out 100 brochures, who cares? You gave out 100 brochures. The key is how many email addresses did you get? How many names did you get? So that's kind of the way we've looked at our marketing so far. And so people do come. We've gotten people from the outside who come in and are like, oh, you have an integrated medicine center. Also internally, we've been promoting integrated medicine throughout the departments and divisions. So we have a little PowerPoint that shows physicians how to refer, what services we're offering, what events are coming up, and it's quick. It's really quick, 5 minutes, and then we give them all, how to contact us. And so we do both internal and external marketing, and then patients, and then our own physicians will sometimes self-refer. So they'll tell the regular patients, why don't we spend a longer time? I feel like this is a topic maybe we should explore more. And I have this integrated practice where I see patients for an hour. Would you be interested in that? And then they get patients that way. So it's multi-pronged for sure.
Okay, well, this could go on. I'm going to have to stop and we've gone for a little bit. I think it's been a really illuminating, exciting morning, and repercussions will no doubt ripple out for quite some time. If you all can stay a few minutes, if people have questions you want to address individually for our speakers, that'd be great. Otherwise, thank you all for coming. We'll be meeting next month. Do we know where yet?
It will be here, February 5th, and in fact, Armady Austin will be talking about underserved communities and integrative medicine. So she'll be bringing some of our students who went to a conference last year, actually. So I'll get February 5th here.
So thank you.
You did such an amazing job with this event and even making this all possible for us. Thank you.
Thank you. So I'm getting cash.